Good afternoon. It's a beautiful sunny Thursday afternoon, and I'm lying. It's hailing here, so it's not sunny. Debbie, what's it like up there in Alberta?
I had snow on my car 2 days in a row, Wednesday and Thursday, or Tuesday and Wednesday. It was -10, and I should have looked that up to see what the equivalent was. Anyway, it was cold. We needed a purpose.
We've all been having, and the Midwest here have some terrible storms and things. So anyway, welcome. If it's your first time here, definitely welcome. This is something we started during COVID so that we all wouldn't lose touch with each other and so that we could continue to build a community and know each other and help each other. So we're going to keep doing it. We do it the second Thursday of every month. If you didn't get an invitation this time and you're here because someone else gave you an invitation, just email me and say put me on the list. Just juliaoverstreet@yahoo.com, and then I'll make sure you're on the list to get future invitations. Also, if you're here for the first time, over on your right on the control panel, there are some gray boxes in about the middle of the control panel, and one of them says handouts. And there are two handouts. One is your CE certificate for today, and the other, don't worry about unless you just want to. It's a print or a handout copy of the PowerPoint we're going to show a little bit later. But it's long, and I only did 2 per page, so don't print it out unless you really want to. But it's there. If you don't see handouts in the gray boxes on the right, go up to the top, the very top of that control box, and it says File, Options, View. Hit the word View, and then you have a list of things that are on that box you can see, and one of them is handouts. So that may not be checked for you, so just check it, and then you'll be able to see the handouts box there, so you can download the CE. So please do that now, because once we finish everything, you obviously won't be able to download it anymore. However, it will be up in the cloud, as will the video of this, and that web address is on the invitation that you got to this. And on every single invitation you've ever gotten at the bottom, it's tinyurl.com/footcaremeetings. It's also over there on the chat box in your control box. We always leave it there. So that's where this will live later, and the CE will live up there in case you need, and the handout if you want to get that later. You may notice an absence today. Our colleague Bonnie is not with us today. She's under the weather. She's getting better, but you know how it is when you just feel yucky. I'm sure yucky is a Latin word. So she's going to be probably watching the video later. But she's fine, and I'm sure she sends you all her best. We have 2 guest speakers today, and so I'll keep them a secret for a while, so we can't do it. What I wanted to do was kind of a catch-up program, and because I have a lot of things that some things are brand new, but some I just have been holding on to that I wanted to share with you. And so we're going to go through some of those today. So it's not just one topic. And I hope that's fun and keeps everybody interested in it. Let's see. Does anybody have any announcements to make or questions to ask? You can, Deb, help with that. Undo the microphones. If you want to make a comment or anything, you can find your microphone button, which is on the top left-hand side of that control box. There's a microphone icon in a little circle under a red arrow. So if you want to say something or make any announcements or anything right now, this is the time. Go ahead and click on that microphone. It should turn green, and then we can hear you.
It's unlocked.
So it's unlocked. If anybody wants to say hi or have an announcement or anything.
You could also put it in the question section if you want.
Yeah, you can put it in the question section. Let's see, I can't even see. How many people are here, Deb? I can't see.
85.
Okay. All right.
Ah, Kirsten from Nova Scotia.
Welcome, Kirsten. All right. Well, then maybe we'll just start with it. Like I said, the PowerPoint is kind of piecemeal, and there's several different sections of it. So hopefully you can all hear us okay and see us, but give me just a second. I'm going to get rid of Debbie and I and put up these PowerPoint. Debbie, say goodbye, and I will say goodbye. Actually, I don't have to, and I have to find my PowerPoint, which is there, and do that. All right. So, well, that didn't work. There. So hopefully everybody can see the beginning PowerPoint slide. If you're having trouble, put it in the chat box and Debbie will see if she can help you, because I don't have that part open. So the first thing we want to do, I just forgot something. Lisa, go ahead and turn your camera and your microphone on. So our colleague, Lisa Simmons, is going to help out with us today. She's working on a project and needed your input for it. So it's very exciting, and this is exactly the kind of thing we want to do, is help each other advance the field of foot care. And so Lisa sent some things to me, and I have them here on, she made this beautiful PowerPoint, but she needs your input on some of this. So I'm going to turn it over to Lisa, and I'm going to turn my picture off. You see me enough, and let's see but I'll be listening. Okay, Lisa, so tell us about what you are doing, girlfriend.
Okay, I am a student at Grand Canyon University right now, and I'm working on my master's with a focus on public health and nursing. And I've had a project throughout the year working on interventions. And one of those things that I've been working on is establishing a nurse-managed clinic, a foot clinic, and I wanted to incorporate screenings with that, like A1C screening. So one thing I noted as a community health nurse, I had worked as a community health nurse for about 11 years with the tribe here in the Upper Peninsula of Michigan, is that there were quite a few individuals with diabetes and with complications from diabetes, and one of those was amputation. So I was trying to figure out how to help. I did resign recently within the last year from my job, and I became certified as a foot care specialist, and I started this program with Grand Canyon University. So I'm looking for input because I'm trying to find out if I'm within my scope of practice, managing a foot care clinic, and also the ethical guidelines of how to introduce the screening process and recommended screenings, and how to direct the data that I hopefully will have from those screenings. So I did put together a PowerPoint. We know that millions of individuals in the United States have diabetes, and millions with prediabetes and undiagnosed diabetes. And I think the most recent data that I saw, and I know there's probably more recent data, but there's close to over 100,000 individuals that have amputations, or they're listed on the hospital records as having diabetes and having an amputation. So that was from 2016. I know there's probably more current data, but that's what I found for my paperwork. And this project, this PowerPoint in particular, covers the Mackinac County in the Upper Peninsula of Michigan, and some of the access, the problems that we noted from this community health assessment 2018 for the whole of the Upper Peninsula of Michigan. I in particular live in Mackinac County. If you'll notice this, just below Chippewa County is Mackinac County. And you can forward the slide, Dr. Julia. And what I noted is this is data from just specifically Mackinac County. there's a 21.3% of individuals who are unable to access health care due to cost. And of the whole UP residents with less than 25,000 annual income, there's 19.2% unable to meet or unable to access health care. And there's 15.6% living with diabetes, and close to 30% report health status as fair or poor. You can advance that slide, Dr. Julia. And so this is what we have in our area, in the Mackinac County area, for interventions for diabetes. And that is 2 satellite clinics and a hospital in St. Ignace. And I know of one diabetic case manager at a hospital in Schoolcraft County. I don't believe in Luce County, which is a neighboring county, that there is a diabetic manager there or educator. And I'm not at Mackinac Straits Hospital. I believe there's a diabetic case manager. And I don't know that we have any current programming available locally. Okay, Dr. Julia, if you'll forward that slide. And this is just challenges for providers in rural health, trying to keep physicians, nurse practitioners, nurses and healthcare workers in the county, trying to work in the innovative practices, having to be flexible as an organization, the community integration of programming, and there are high rates of staff turnover in this area, in many of our areas. And if you'll forward that slide again. And this is just a picture of what hopefully I would like to do, and that's to have a small nurse managed clinic, provide foot care, and do at least the A1C testing. Okay, we can forward again, Dr. Julia. And I would like eventually, I mean, I have a wish list. I know that everyone does, but technology is going to need to be part of what I believe a nurse managed clinic does, because I want to have a strong referral process, and I want to be able to send the data that we obtain to a system, and also to consult with any a local podiatrist. And we don't have, we only have one podiatrist at the neighboring county in Luce County, and he is only there every other Thursday. And then we have a podiatrist in another neighboring county, and he is there still not full time because he's divided between another county. And so we just don't have a lot of what we need in this area as far as podiatry. And then if you'll forward, so I'd like telehealth. Nurse managed health centers. I did find with my research, there's the National Nursing Centers Consortium, and it's a national network of over 200 nurse managed health centers, and they're serving millions of patients nationwide. And so this consortium works to develop these nurse managed health centers to increase access to care and eliminate disparities. Okay, if you'll forward again, Dr. Julia. This is just evidence that I'll go through, and to supporting evidence of having a nurse managed clinic. If you'll forward again, Dr. Julia. Okay, I had 2 articles, and these were nurse managed health centers. One was in a community, and I think that they were associated with a school of nursing, and they did have nursing students that would come through there, but it talks about the process of a community health needs assessment to support the implementation of our development or establishment of a nurse managed health center. And that was a very good article. And they also, an article that was just a nurse reporting what her duties, what she did in the community at the nurse managed health center, and what services she provided, and how the community responded. And those were both very positive. Okay, Dr. Julie, if you can forward again. And I just provided an article. This one was from Africa, I believe East Africa, that talked about how important the A1C was and how difficult it was to obtain the materials and the equipment needed for that. And let's see, analyzers need to be available point of care and cost of supplies subsidized. Decentralization of services to facilitate increased clinical visits, those living in rural areas. Proven significant improvement in median A1C. So having those services available, being able to screen is very important to controlling the burden of diabetes in a community. And I did like this article in particular because they were having trouble. The analyzers are expensive, and the cassettes that are used in analyzers for A1C screening are also expensive. So it was difficult to keep those, the equipment and those cartridges available in their communities in this area of East Africa. Okay, Dr. Julia. And I do have to support what I'm doing with the, there is an intervention wheel that's used by that was developed by the Minnesota Health Department. And part of that intervention is case management, surveillance. And so I believe that that fits in with what I'm trying to do with a nurse managed clinic. If you'll forward again, Dr. Julia. And this just is talking about surveillance being an ongoing systematic collection, analysis, and interpretation of health-related data. And if you'll forward again, Dr. Julia. This is trying to get on board the important stakeholders and community members in the area to support a nurse-managed health center. Okay, Dr. Julia. And also trying to be culturally sensitive with this intervention, learning more about by being culturally sensitive, trying to learn more about the community and their needs, work with cultural mediators, learn and use words and language heard in the community, offer alternative ways to provide input, plan to invite from the community particular members for meetings, and work with interpreters as needed, and incorporate culturally acceptable practices, and connect community members with culturally appropriate resources. So I would appreciate any questions or input regarding this effort, and I appreciate your letting me talk today. I have contacted our local Michigan State Nursing Board, and I also have contacted the Michigan Nurses Association. I have contacted the American Nurses Association to try and see if I am doing this the way I'm supposed to do this. The approach is very important to me, and so far I have joined, and I don't know if everyone else is aware of this, but the Innovation Community Digest, which is from the American Nurses Association, and there is a wealth of information at that site. And I'm still trying to delve into it. I mean, there's so much information to find answers to my questions. And I just joined the ANA Innovation Lounge, and I have I've written to a local journal about the funding that they have, Michigan's Economic Development Corporation, and trying to find funding for what I'm doing as well. So. Anyway, that's been my journey so far. I'm sorry I'm so quick about it, but just trying to get everything in.
I think that's great, Lisa. But next month, by the way, our speaker is a person who works with a grant company and has worked with the getting the grants that Bonnie has for one of her projects. So definitely watch our program next month in May.
Great, thank you.
So to ask them some questions, ask them what you need to know. What do you need input on?
I guess I just want to make sure that I'm within scope, because I will have my master's degree and establishing this nurse managed clinic, and ethical guidelines. You know, when I'm offering screenings, not wanting to target any one particular population, but being able to offer that to all people who come to the clinic, and then how to direct the data, how to collect and direct the data is, important to me. And
well, let's start at the beginning though. So has anybody worked in a nurse managed clinic like this? We have one question from Elizabeth Creasy. Does a nurse managed clinic require a medical director / physician to oversee?
I do not believe so, but one of the articles that I saw, that the nurse managed clinic was associated with a university. So, but I believe the nurse still managed that clinic. And
I think you'd have to have someone there to order to bill Medicare.
oh, okay.
So that's
Okay.
one issue, because that takes a physician or an advanced practice nurse to be able to get a Medicare provider number. So beyond the just legal thing of can you work managed or not, you got to have somebody there to bill under, because RNs can't bill. Here's another one from Scott. Eastern UP hosts the SALT tribe and has several VA clinics, as many tribal and veterans in this area could offer some support. Speaking as a tribal member and veteran. And by the way, the SALT tribe does work with Rainier Medical, so I'm familiar with them. They have foot care there. So Scott, thank you. Scott, if you want to turn your microphone on, you can talk too.
I think I've got them open.
Yeah. So just find that little green microphone button on your control panel. It's up toward the red arrow.
I don't do a lot of speaking out loud. That's not really my strong suit. I'm a military veteran, and I'm a Youper from the Sioux tribe. So I know some of the resources that you have available in your general area. I grew up in Alger County myself. But a lot of the members in your community, especially those that are in the lower financial status areas, would be able to qualify either as a tribal member or as a veteran. So if you can build a partnership with those entities, you're going to be able to build more resources for yourself to not only reach those individual members, but be able to seek out more overall care for everybody.
Okay. I appreciate that.
Go ahead, Lisa.
I do have a clinic. It is a free clinic. I provide free services at it's called Love Inc. And it is a faith-based organization. And I also provide a pay-for-service at a local salon. And at the I did have one VA veteran that just came, and I saw him this week. And he did talk a little bit about his struggles finding care. And he does have quite a few complications, some problems with his feet. So I'm trying to connect him with resources. So it's I'm just working on that right now to see what services are available and what resources are to him.
But I think what Scott's saying is, if you could tie this nurse-based clinic in with them, not you doing individual work, but you're
right.
trying to start a clinic. And I think what
yes,
Scott's
that's
saying
what
is
I want to do.
To form a partnership of some sort of referral base. I think
Right.
I don't mean to speak for you, Scott.
Thank you.
No, you're doing great. The veteran, if they use the VA system, they're probably best in Marquette or Gladstone as far as the bigger clinics within that area. If their primary care will give a community care referral, you could get qualified in for that and work with them in that capacity.
Okay.
But community care is the key words that you have to reach out for, because they only give it to you if you ask for it.
Okay. All right. Thank you.
And who would she ask?
She would have the veteran, the actual serviceman, ask for community care. If the VA can't provide adequate care for their needs, whether it's the routine foot care or whatever else, she could do the routine foot care as a community care member. I work for Prevea, which is a Wisconsin-based system. And during COVID, when the VA was shut down a lot of services, I actually had my leadership team work through and create that partnership between the Green Bay VA and hours clinic system, I was able to care for and cover some of our veterans in our area as community care, where it didn't cost them out of pocket, and it eliminated that one more barrier of financial cost.
Okay.
That's fantastic. So she needs to go through a veteran who can connect with his veteran service advisor. Is that what you're saying?
That is correct.
Okay.
Thank you.
Thank you, Scott, and thank you absolutely for your service also. Let's see. Pam Lindgren, I wonder, doing insulin testing for levels or to find out prior to a diabetes diagnosis so they could make changes, dietary changes. So I guess she's asked, both, Pam, I'm thinking it would be both. If you can catch them in, would you just do across the board screening or just if they're already diagnosed?
Right. I would try to go along with the American Diabetes Association, their guidelines, but I would like to be able to catch, you know, that or undiagnosed diabetes.
Yeah,
There are
okay.
so many.
Super. All right, that's what she's saying. So here we go. Daniel, I work at the Louisville VA, and we have 3 nurse-run clinics in the surgery department that I am part of. Nurse-run, Daniel, nurse-run for foot care or for wound care? And that's a little bit different because you don't have to worry about billing at the VA. Okay. Because there are certainly nationwide, except in the Texas area, wound clinics are mostly nurse-run. That's what I'm most familiar with. So I know that that's a huge thing, but they have to set it up specifically so it can get billed. Nadej, you wanted to say something. Go ahead and open your microphone.
Hi, can you guys hear me?
Yes, we can.
Okay, great. Lisa, that was a great presentation, by the way.
Thank you.
So what I understand in your statement in regards to the one clinic that collaborates with a healthcare system, is that what you stated?
That's what I would like to have.
Okay.
Yes.
Yeah, so in order to bill Medicare and Mass Health and also those who have health insurance through the VA and aren't able to get appointments because they're overwhelmed, and so they get the special permission to see outside providers. The way to be able to capture that market, and I think you might have mentioned it or alluded to it, is to partner with a small clinic or an organization or even a school clinic in the area where they do have a director director of medical director who would otherwise be a doctor, and then you could have that conversation with the doctor and say, hey, this is what I'm trying to do, present and literally sell your would be to review charts, or that any complicated cases you would then review and send over to him for care or send to specialists. That's how I think you'd be able to do it. And you would have to have the right partnership, because without the right partnership, the person may pull out at any given moment and leave you hanging dry. But if the person is invested in what you're doing in your clinic and in your model, then it would be a great relationship. And I think you can absolutely have a great, successful business. What you're trying to do is amazing, because I know the rural areas are really tough to staff with NPs and doctors to provide care at the primary care level. And nonetheless, to think about the podiatry level, it's insane for foot care. Doing the A1Cs baseline test results is fantastic. I love that you're going to do that, because you will capture a lot of patients who are undiagnosed, which when I worked in the outpatient setting, that's what I did. At baseline, if I didn't see it in the chart, I immediately ordered it, and I captured a lot of undiagnosed patients. And then also, with that said, just remember anyone who has neuropathy symptoms or unhealed wounds or slow to heal wounds, that's your tall tale. They possibly have diabetes, and maybe it might warrant to have a quick check very quickly. If they're pushing back and saying no, they don't want it. That's always like my go-to. I say, well, high levels of blood sugars for over long periods of time does lead to neuropathy symptoms in the feet, and you likely might have diabetes. So let's check. But I love it. I love it. Love you
Thank
too,
you.
Julia and Debbie. Okay, I'm going to go on mute.
Thanks, Nadej. Appreciate it.
No problem.
I appreciated that.
Okay, Mary Sanford. New Hampshire has primary care practices that are staffed just by nurse practitioners. New Hampshire is a full practice state, and there are many nurse-run clinics that do not need medical staff on staff. I think that's true here in Washington State as well, because they can get provider numbers. But I know in Texas, I'm hearing a lot about they don't have that ability in Texas. Not sure about other states. So I think it's state by state whether they have that autonomy or not as nurse practitioners. Anybody know about that? Well, and that's the other question, Lisa. Are you going to be, after your master's, are you going to be advanced practice at that point?
Well, I guess I hadn't thought what to do after that. It's been.
But is that is master's, and it's just my ignorance, will you be a nurse practitioner when you get your master's? Or is that
Right
another
now,
step after the
That's
master's?
another step, because I do start my practicum in June, and that's 120 hours, I believe, to be a nurse practitioner. That would take over 200 hours. So, you know, I guess if I switched, but what do I need, in order to manage a clinic? What do I need to do? Do I need further certification?
Well, to my understanding too, I can answer that a little bit.
Yeah.
It depends on who your funding is. If you're being funded by a private funding group, like who's going to speak next month, they might have requirements for the director.
Okay.
But it's more likely to be requirements for experience in running a bigger organization. So I think that's part of it. And, as a director, you don't have to be the person that they bill under. I mean, you're talking about different roles. You can be the executive director and the coordinator or whatever, and have somebody else who's the advanced practice nurse or the doctor or whoever, who may or may not be on site. It depends on what your state requires or the insurance company requires, if they have to be on site and whatever. So you don't have to be anything.
Yeah.
You don't even have to be a nurse to be an executive director of something, unless somebody requires that you do, and that's not the state. That would be your funder, or that would be some corporate sponsor, or something might require that. But
I do have a doctor that is working with me. He helped me to get this practicum experience at Schoolcraft Memorial Hospital. So I believe that he would be, maybe he would be open to, further involvement. So.
okay. I love it. Let's see, do we have any other questions?
Lisa, what's your
What?
cat's name?
That's Mr. Kitty. So
Well, Mr. Kitty and
very
yourself.
special, because he usually does not come out for people. So I'm very surprised that he's in the picture.
It was very cute. A minute ago, he was standing behind you and just staring, totally still. And I thought, is that a picture? What is that?
Yes, he's kind of unique.
Okay. What other questions, or what do you think, Lisa, about what you're hearing? Is that
Well, this is all good. A lot that I can work on, and I just continue to delve into or find information that leads to more information. So I appreciate all the responses.
Do you want to give your contact information if anybody is here that wants to talk to you more or thinks of something later?
Okay. Yes.
He wants to go.
Yeah. He's trying to turn the camera off. L. Simmons, AWNB @outlook.com. And my number is 616-227-6569.
Maybe put that in the question box or the chat box so they can copy it down later.
Okay, I sure will.
That would be great. Bye, Mr. Kitty. That's fantastic. Well, thank you for presenting that. That's the kind of thing we want to help with, because certainly that's one of the directions that foot care and nursing goes in the
I
future.
really appreciate that. I found so much information that has helped me on the path that I've taken. So from the American Foot Care Nurses Association and you all.
I
Appreciate
appreciate that. The
Okay.
one more before we go. Elizabeth Creasy says, collaborating with a medical director to have developed protocols and pathways for ordering things like labs. Thanks for that.
Thank you.
Okay. And if we get other comments on here, we'll forward them to you.
Okay. I appreciate it very much. Thank you.
Okay. Hopefully this was helpful.
It was helpful. Yes, thank you.
Okay. Thank you. Bye-bye. Okay. Let's go to the next one. Now, I want you to all hang in there, because toward the end, I've saved the best for last. Toward the end, we have information on our new hands-on foot care clinic. We're moving and we're upgrading and do lots of things. So I have pictures for you of those of you who've been to our hands-on foot care training here in Washington State. A lot of changes there. And toward the end, I have pictures for you of our new facility. It's just awesome. And our colleague in South Africa is here. She had her first class. And so we have pictures. We have her here. She's going to talk about South Africa and how that's what we're doing here. She's doing there. Now, she's done it before, but now she's setting it up too in a very organized and official training program. So don't go away. We have a lot of things. Okay, I'm going to put the slideshow back up and go past that and go there. I have to talk to myself. Are you at that point in life? You have to talk to yourself, and put that as that. And Debbie and I would close our picture or whatever's.
Yeah.
And so this is the next little section I want to go over. But I've been asked a lot about this, and a couple of you I worked with independently, you'd called me or emailed me with questions about shoes and slippers and things for really big feet, because that's an issue. So I've come up with a couple of resources, and I wanted to share them because that's a problem for a lot of us. So I've been just sitting on this after working on it with, like I said, with a couple of you for your own patients. So just a few slides of this. Don't worry, it's not a whole big thing on shoes. Shoe resources for large, wide, and swollen feet. And the important thing that we want about when we're looking for shoes for that kind of vulnerable population: stability when they walk, don't want it to be a fall risk. The ease of donning, and donning means putting it on and off. Donning and doffing is putting it on and off. The durability of the shoe, we don't want it to fall apart in 6 months because they're never going to buy them again. And the price, okay? And in the bottom right hand, I just have to say this: I have no financial interest in any of the businesses that I'm going to name right now. I have nothing, no financial interest. So they're just the result of some research. Okay, so this, let's see, this is a cute video. So watch this. This is not the slipper thing, but what do we find so much? They come in, especially the men, and they are walking on the back of their heel. Now, how stable is that? What kind of fall risk is that? And they can't get down there, and they can't work one of those big long shoe horns. So how can we find shoes for them that they can use without that? Oops, sorry, what did it do? Oh, there we go. Okay, whoops. Oh, next slide. There we go. So this is their shoe. They're amazingly affordable. Now that's in our terms, not our seniors' terms. $139 under 40 for all of these. Now, and I know you know this too, in their lifetimes, they haven't spent $139 on what? On a car, I don't know. that's a lot of money to them. We're used to that number, but most of these specialty shoes, and even this kind of shoe, until very recently, were in the hundreds and hundreds of dollars. And still, if you try to get a specialized diabetic shoe, that one you might be able to get under the Medicare shoe bill, but you don't have that, so you are buying it yourself, it can be $1,500 to the patient, not to the provider. So $139, you're still going to have to, it's still a chunk, and I get that. But having them be able to put it on like that and take it off, so they only have to tie it once. And you saw how easy it was. And this company is called zebashoes.com. Okay, a couple more of these. Come on, go. Here's another one, thebarshoe.com. So these were for more the swollen feet, because that's a huge issue. They can't wear their shoes, and that's a fall risk. They're trying to wear shoes that are not stable. And these are down in the $60 and $70 price range, which is awesome. And look how adjustable this is a Velcro tab, how adjustable that is. Another one with a big tongue, so you can kind of see it here. These are the same style, where this opens up, and you'll see more pictures in a minute. This will open up all the way to the toe. You can flip it all the way back, and then it's a huge range of adjustments to it. So as we know, the feet get more swollen, less swollen, more swollen, less swollen. These two in particular have a lot of expansion available. And they mention this specifically, it's wide in the forefoot for hallux valgus. What is hallux valgus? You saw my bunion lecture. Hallux valgus is when the bunion goes out this way and the toe goes that way. So it's going to be wider in the forefoot is what they're telling us. And fat, wide foot, I love that. So those for $70-ish for these really fat feet, and as long as they fix put the Velcro on properly, it's pretty stable. And any shoe repair, I know that's hard to do these days, any shoe repair can replace Velcro once it gets too worn. And here's another one, the Summer Wind Comfortable Collection, breathable, whatever. It's not going to be as adaptable to really expanding and contracting feet, swollen and unswollen. But there's a big range, just like 2 inches here, that's still to go, where that could get a lot bigger. And it has a back in it. I don't ever wear a backless, have them wear a backless shoe, but it's kind of a sandal. So this is the barshoes.com. This is that same company, the barshoes.com, but they also have some more everyday looking shoes. They don't look quote unquote diabetic. So you can see this, and all of these have that slip on. Their heels are made such that it will slip on. Oops, did I tell you that right? Yes, I did. I'm sorry. Okay, and then those, and they also, this particular company also makes some wide socks and wide, the slipper socks for $19, which I think is amazing. Oops, one more. The Kizik company, KIZIK.com. Okay, now you're going to laugh, but I thought it was an appropriate video, and particularly the shoe that this gentleman is showing is one that a lot of my male patients would go for. Okay, so that isn't an extra depth shoe. It's as deep as an athletic shoe, but not extra depth like the ones a couple of pictures ago. But those are nice dress shoes that don't seem to have a lot of seams in them that are going to rub or anything like that, and they can get them on. So a lot of my male patients I can see with that. They have a woman's line as well. And this is more in their line that just looks more traditional, but you can see I'm sure that in this shoe, you can see it on the outside. I'm betting that's the same technology, if you will, on the inside of that shoe he was just putting on. So all of their shoes, you can do that with. They can put them on without the back coming off or going underneath. Okay, and here's the last company I found recently that I wanted to talk about, Silverts, SILVERTS.com. It has a whole rehab line of clothing and not appliances like wheelchairs and things, but of adaptive clothing and for special needs and that sort of thing. Fascinating site. You go there, it's just interesting to look at what they offer that solve some of the problems that you have in long-term care as far as dressing and undressing, and some really clever designs. But their shoes, here we go, another one where you can open practically the entire shoe up. So if their foot is now, like that, I'm not sure. I wish that looked a little bit wider, but maybe just the way they're holding it. But I think this would go over a pretty big foot and to protect it. It comes in lovely colors, as you can see. And I guess now that I see it on this angle, there's about 3 inches that the foot could get that much bigger. And it looks like a nice solid sole, not too slippery with this Vibram situation. In that same company, now these are slippers, and they're in the $19 range, I believe. So I could be wrong on that price because this one is a slipper and it's about $19, and it's the same sort of thing. This can really open up wide. This is on the street sort of shoe that they have that has kind of the same design. So they're in the $55 range, which is amazing that they would be that cheap. I think that they go up to 14. I think the next slide might show that. But you can guess that this shoe would, for a woman, and they have men's, would accommodate a really big foot and keep it snug in there and prevent falls. So Silverts.com, I think you should definitely look at. Those prices are amazing, and they're good looking, and they look like, to me, they have good material and good workmanship. Here we go. So then Silverts has sizes 7 to 14. And I love this. They give you the length and the width, because it's not true that a 10 is that much different than an 11. It's volume. It's not how much further it is in most cases, but it's not left to chance here of us not really understanding how it goes. And you can see here an 11, 12, 13, 14 are all 4 inches wide. So it's not true. That's not A, B, C, or D. This is a little bit proprietary to them, but you can see what I'm saying. The size doesn't necessarily translate into big changes here or here. They're just half an inch there and a quarter of an inch here. So they have actually given you something you can measure the foot and kind of see. And specifically, it says, do not go up a size to accommodate width or swelling. These men's wide slippers can be worn as a shoe, in other words, outside. These very wide slippers are terrific for those with arthritis or lowered hand dexterity. These adjustable extra wide width slippers make the best diabetic slipper for men and men in rehab centers, skilled nursing facilities, home care, and long-term care facilities. Extra roomy, depth, extra wide width slippers for swollen feet and ankles are great for patients in hospitals, post-surgery, nursing home patients, residents, and retirement homes. These extra wide width men's bedroom or house slippers by Silvert are perfect for comfortable casual in the home and for home care settings. So let's see, I want to go back for just a second. So these are amazing, and they're $55. It's Silverts.com. I wish I had a financial interest in them. But, and like I said, it's fun to go to this one. The others just have shoes and socks. This one has a lot of different apparel that's, like I said, solves different problems in those same settings. So definitely go to Silverts. Whoops. Okay, now, Debbie, were there any questions about any of the shoes? Here it is. I kind of see some, don't I?
And in Kizik's, there was a question about whether or not they would offer extra wide sizes.
Well, they
Lori,
do.
okay, Lori was just noting that. Okay.
I don't think Kisix does. Let's see if I don't have their sizing thing. I think they do, Lori, but just go there. It's fun to look anyway, but I'm sorry. I thought they all did. Maybe I missed that. I think just by its nature, it is extra wide. And I didn't see a chart there like it is here, but I didn't go through every page of the website. Oh, here's another one from Christine. Check out billyfootwear.com. No financial interest. Billy, B-I-L-L-Y footwear.com. Ooh, I want to do that right now. Thanks, Chris. That's great. Anybody else have any favorite ones? Actually, whoops. I'm just sorry. So Lori, actually I didn't. Okay, yeah, see there. Okay, billyfootwear.com. Okay, I'm gonna look that one up. Anybody else? Debbie, do you see anything else coming up?
I'm just hunting. Ah, I lost my screen, sorry. Can you hear me?
Yes, I can hear you.
Yeah, I just can't. I'm working.
Cozyfeet.com. Nadej says cozyfeet.com.
Okay, thank you.
C-O-Z-Y feet.com. That's awesome. This is the kind of thing I really want to do with our group, is help each other with this sort of thing, because everybody needs these, all of our patients. Thanks, Nadej. I'm sorry, Bonnie, I can't flip through this very well. Do you see anything else? Or Bonnie? Debbie?
We're the two Bonnies, guys, in case
I
you
know.
missed me.
I always do that. She's not even
Okay.
here and I do it. Okay.
Is it possible for Lisa to post her contact information on the questions section? Because, you know, it was very interesting and there's a lot of people who'd like to get in touch.
Lisa, are you still there? You can turn your mic on if you are to let us
Yes, I
know.
am.
Otherwise, we will post it.
Yes, I can do that. I'm on the right-hand side. There's just 4 boxes. Where do I go to communicate that?
Click on questions.
I don't see that box.
Then
I
go
just
up at the top to view. Go up the top, file options view. Do you see that? Very, very top.
At the very top. All I have is a red arrow, mic, the camera, and then the file.
Okay.
You should, okay, next to your, what's to the direct right of your red arrow?
Right now,
Actually, just say it again. Debbie, would you copy it down and Debbie can put it up?
okay, it's L Simmons, AWNB @outlook.com.
Okay.
And 616-227-6569.
616
227-65.
227.
That's right.
Got it.
6569.
6569.
Yeah.
Okay.
Oh,
No,
I
She'll put
found
that
it.
up. Actually, Lisa, I'm seeing some new comments about you. Jennifer says, I know the Merrim Healthcare Clinic in Plummer, Idaho services the native population with diabetes and foot care services. They do a great job and may have some information that might help you. Good luck. I will, Lisa, print out all of these questions so you have them and the person that did it. And since you are all members of the association, right, all of your contact information will be there.
That's right. Thank you.
Possibly, Emma. If you want to provide care, you need to be in. Okay. So anyway, I will, Lisa, I'll forward these to you because I can get all these questions. So any of you that want to say something else to her, you can contact her directly or put it in the question box and I will forward all these questions to Lisa. I'm so glad that there's interest in that. It's such a great cause. And thanks for the different names of shoe stores.
Okay.
Elizabeth says to Lisa that all she has to do is click on the red arrow and it'll open the screen.
Oh, yes. While you're doing that, let me read from Nadej. Also, do we know what happened with Medicare approving the diabetic shoes? What do you mean? I mean, it's been there for 20 years. In Massachusetts, a lot of the orthopedic and prosthetic facilities and some podiatrists are not doing, yeah, I can tell you why, not doing diabetic shoe fitting anymore. They specifically informed they are not getting reimbursed. Yeah, they are. Okay, I shouldn't say that. It's a pain in the you know what. I used to do them too a long time ago in a big galaxy far, far away. The problem is it's really hard. Okay, I know some of you do this. For me, it was very hard. People don't like the shoes, so you've ordered the shoes, you showed them before they came, and they order them, and you fit them, and you really can't return them, and you get them, and they don't like them. And I'm thinking, this is not Nordstrom's, and you end up with a locker full of shoes that you can't return, that they just didn't like for some reason when they actually saw it. And you know, if they charge in person for it, you get like $1,500. If you charge cash, Medicare pays you like $600, which is even a lot there. There's a lot of reasons besides they don't get paid. That was just the easiest thing to say. It's still, the Medicare shoe bill is going strong. You don't even need to have you don't even have to be, have some of the prerequisites you did years ago. They've loosened it up. It's still there. That's just them telling you for other reasons. Most of us quit in podiatry. We all start doing shoes and it's just not worth it. We'd rather send them to someone who does that. Okay, I'll click the red arrow. So you guys are doing that, huh? Okay. All right, let's move on. So, guys, those of you who have been to the our hands-on foot care class here in Seattle, we've been doing this a long time. 2010, I didn't remember. Let me turn this on. There we go. Now you can see my beautiful face. 2010, I can't believe that it started then, but it did. And I'm asked a lot, so I'll just say it. How did you start this? I didn't exactly have a business plan in 2010 and thinking, you know, I bet every nurse in the country will want to know how to do this. That's not what happened. My specialty, as most of you know, is wound care, and a number of my nursing wound care colleagues asked me back then, could I teach them how to do the routine foot care? Because you see that in wound clinics. A lot of you know that too. And it just hurts your heart to see it. So, sure. So I made arrangements with a local senior center to do it there because I didn't have the kind of practice where I could have them in my place. I took, I don't even know anymore, 4 or 5 of my wound care nurse friends there, and we did it for a couple of days, and that was it. And a couple months later, I get another call from another group. Okay, so I brought them in, we arranged the whole thing again, and I taught them. And that just kept going. And I never thought this was a thing. I had no idea that this would keep going. I'm guessing now, 12 years in, that it's a thing, that there's like 100 and something of you on the web today for this program. We're always booked 3 months in advance for the hands-on class. It's just been a ride, and every month I think, okay, that'll probably do it. We'll have everybody trained now. And it seems like this is actually a thing. So one of our problems was after COVID, or because of COVID, the space we had been in for the last 5 years got too cramped because we had barriers up and we had 6 feet apart and we had all this stuff. And suddenly there wasn't enough room. So we realized we had to move, but then that's its own problem. So what I thought I'd do just for fun, by the way, this last month of, what was last March, was the last month in that older building. And this month, April, next week, we started in our new facility. And I'm just real excited because of some of the upgrades. I finally accept the fact that it's an ongoing thing. So I've upgraded. But I thought it'd be fun to go through history, right? So program history. Back in 2010, we were at the Issaquah Senior Center. We were there for about 7 years. We were sitting on the floor. We all had our Dremels. This was, those of you who've been, no, in the morning, we have a session in the morning where we all sit around and we learn how to use the instruments, and we learn how to hold the sanders, and we use plastic things and a balsa wood, spoons and things to work on. So this was the morning session, and it's a senior center. We didn't have anything. The nurses would sit in a chair, the legs would go in another chair, and they were in the 4th chair. There weren't recliners, there were a little bit later on, but and sometimes you had to sit on the floor, but there we are with the Dremels in 2010. And we did that for a long time. That was a lot of sitting on the floor. Thankfully, I was younger. So, and it was a good program. It was just me, and I think we took 5 nurses. Looks like there's 4 here, but I'm sure there were 5 that were in each class. And it was 3 days. It was, I had to take everything there in big rolly suitcases every day because we didn't have a room there. So we were seeing 40 patients in the senior center setting, and I had to bring it all in giant suitcases. Like I said, I'm glad I was younger then. Okay, so in 2017, we outgrew that and moved to our first actual facility. So this was, we were there for 5 years. We just finished our last program there last month. I actually leased an entire space, and I got recliners, used recliners. They were donated, most of them by the seniors when we told them what was going on. I have one, my husband passed away, whatever. So a lot of Angie's List, those orange chairs are from Angie's List. And we had the Dremels. So this was 2017. And up at the top, well, I guess some of these are later than that because I see if we have the good Sanders there. So I apologize. When we first moved there in November of 2017, we still had the Dremels. We had them for probably another 3 years. We used the Dremels. And then I was beginning to realize that this is going to keep going. I better invest. So I bought 6 of these very expensive vacuum sanders and put them one at each station. We had 7 stations. And it's at that point that Bonnie and then later Sarah, who's I think in attendance today, became mentor or proctors with me because I just couldn't do it anymore. We had 7 nurses now because now I had to pay the rent for this place and pay for these 7 vacuum sanders at $2,500 a piece. So it was all of a sudden a bigger thing. We had more nurses. I had 2 proctors helping me, and it was beautiful. And then COVID came. So we were off for an entire year, as most people were. So July of 2021 was the first time we came back after COVID, or during, a year and a half later. It's a full year we were out. So now we covered all those recliners in washable material. We got new drawers there that had no handles, were totally wipeable. We had dividers between each station. The stations were 6 feet apart. You can just see down the hallway now, as opposed to, can we go back and see? This was it before COVID, and this was it after. And it was difficult. And as you can see here, this is the aisle in the middle. And now that we had to put chairs on both sides, because before we could just line them up, they were all on one side. Now that we have chairs on both sides, this chair backs up to here so they can reach the feet, and this one backs up to here, and they are bumping into each other, which means we can't get any of the wheelchairs back and forth between them. Everybody's falling. And we did that for a year, just about. That was July of 2021. And about January of this year, things started to get a little difficult. We were having to store stuff in the back behind the chairs, and then we would trip when we tried to get past all this stuff to get to the back to get it. And I finally gave up. And we were kind of at each other's throats because it was so stressful to work in that environment where you're just like sardines. And we decided that's it. We have to take the next step up. So I did the search. I found another place. And we leased it, and we are very, very happy. It's only a quarter of a mile. It's just like 4 blocks away from the other one. So this is that new space. Beautiful light, beautiful floors. And this was my garage full of all of the new furniture because we needed new desks. I mean, we were upgrading. This is my garage. Everything was delivered there, and then I had to get somebody to deliver it to the space. And then, because this is fantastic, I didn't have to put all of them together. The first one, and this is a little later picture, Debbie, this is Sarah, one of our proctors, and Bonnie. And I don't know if you've met Shirley. She's our administrative lead. She's our office manager. So one Saturday, we were trying to get things organized, and we really needed one of these big cabinets put together. So there's Bonnie and Sarah trying to put this cabinet together. And it took about an hour and a half, and God love them, they did it, and it was perfect. And but there were 2 more. That's what these bottom 2 boxes were. There's 2 more of those. There's a huge desk. There's all kinds of stuff. And after an hour of them really struggling to do that, we thought, no. So I found out you can hire someone to put this stuff together for you. It ain't cheap, but that's okay, because there are not enough of us, nor was there enough time. So that's why we memorialized this, because I thought we're not going to do the rest of these. So someone came in, put them all, everything else together. This was the boxes at the end, and we had to pay somebody to come take them all away to the dump. Too much to do. Then after all that was cleared up, these boxes were delivered. 6 of these boxes, which are, this is the beautiful thing, there are new chairs, our new podiatry chairs. Now they're not first level $15,000 chairs, but they are amazing. Let's look at the next one. Those are our new chairs. Oh my God, I am so excited. So these are our new stations. I've spaced it out more since this picture was taken. And I don't have pictures for you like I hoped. I hoped I had pictures of the rest of the clinic, but for various reasons, it's not completed yet. So I'll show you those in another day. But look at these chairs. They tilt, they come up, they go down. It's amazing. We no longer have to stand on our heads, because even when they were in the recliners, we had to put pillows under their feet and we had to get our chairs lower and higher, and it was still a backbreaker. You know, I would warn, and some of you know this, I would warn the students every night when they go home, take some non-steroidals, because you've been doing this all day and you're going to need something if you're coming back tomorrow. So we're so excited. This is our new setup. Like I said, it's nothing's on the walls yet. The rest of it's not finished, but at least I got this much and I'm so excited. So hopefully, those of you that haven't visited us before, now we have an even more professional. We have the beautiful vacuum sanders. We have all these things are all touchless dispensers for cream, for alcohol, I mean, we're still full bore COVID. That's why I spread these chairs out even more. Although I sacrificed the curtains in between at this point, I'm kind of over it. We do require all the precautions, PPE of everybody's shots for everybody's staff and patients, but I had to get rid of the curtains. But anyway, I hope you're as excited as I am. My whole career I had this kind of chair, and it's been really something for these 12 years to work first out of just 5 folding chairs, and then out of folding chairs and recliners, but now we've hit the big time with the fabulous standards and these chairs. So everybody's going to be comfortable, and it's going to be great. So I just wanted to show that to you. We're so excited. Okay, Deb, were there any questions or thoughts? There's no reason to have questions on that. Are you hiring staff? Yes, actually we are. If you live here, we need another proctor. We have another one, Beth, who's been training with us, and she's going to start this week. So we're going to see, but we're still looking for more, because now it's still, anyway, we're going to be adding new classes and things. So I hope you're excited. All right. Well, last but not least, we have our Members Honor, which is a new thing, Member Honors. We've done this a couple of times when people have had their notices in the newspaper about their practices or those sorts of things. But this time we have an associate that you've met before here on the webinars, our AFCNA member from South Africa. And she is with us. Go ahead and turn on your camera. So this is Arinda, who is a CFCS. She is in South Africa. We're going to talk about that. Hello. And she upgraded, like we're upgrading, she's upgraded. She's done this for years and years, but she also now understands, as she always has, what the need is. So she began footcarefamily.com, which is a therapist training and treatment center. So Arinda, talk to me. How are you? Is your microphone on? There you go.
I'm on now.
Yes.
Yeah, thank you for giving me the opportunity to give a little bit of feedback. I'm doing very well. I'm just I forgot everything that I wanted to say because I am so astonished with what you've accomplished. You're really such a motivator for all of us that's trying to help people. You know, I just want to say from my side in South Africa, we're so proud of you and we appreciate you so much.
Oh, no, we're doing it under easy circumstances, not difficult ones. I want to read this. This is from her website, and she's too modest. Arinda obtained certification and registration in the United States as a certified foot care specialist and foot care educator. She is the first individual on the continent of Africa to hold these qualifications by the American Foot Care Nurses Association. We are so proud that you're part of us. But she's been doing this for 30 years. She's worked as a foot care therapist, which is their title there, for past 34 years. She works primarily at old age facilities, but is also privately, some cases. Formerly, she instructed many students for which she developed methods and techniques of improving foot conditions, and in many cases resolving them such that they need not return for further treatment. She has undertaken training in wound care and regularly treats wounds on the feet and is consulted on a regular basis by medical doctors and wound care specialists on foot health. So tell us a little bit about your career, because I know when I first talked to you, I mean, she is dealing with, talk about underserved area. Oh my goodness. Talk about it, Arinda, what your practice is like, or what you've done.
Okay, thank you. My main mission is to help underprivileged people. It's really underprivileged people are really very near to my heart. And more than 30 years ago, when I started out by an old age home that really has no money. They paid me with rusks and jam and stuff like that. Shame, yeah, and they're so poor. So I used to take the rusks and then just put it back in the cupboards, you know, when they don't look, because it's really people that really needy people. And yeah, so my love just grew more and more for them over the years. I do work at a couple of more wealthy old age homes as well, just to get a little bit of the income from that. But I really struggled for a long time until I got certified. It started getting really better. You get a bit of recognition, and I actually have a voice now, which is marvelous. If it wasn't for you, Dr. Julia, and your team, that dream would never have realized for me. And yeah, and my other passion is to create jobs, because in South Africa we're really struggling with the young people. They don't. There's not enough jobs in South Africa, so our crime rate is very high. And I love education and uplifting people. So that's the two passions of my life. And yeah, I also want to create public awareness, because foot care in South Africa is non-existent. Nobody, routine foot care is, I've tried so many times to create awareness, especially with our health department, but I got no help from them. So everything changed when I reached out to Dr. Julia. So all honest to her. And yeah, I'm really appreciative tonight to say that yeah, we did our first course. It ended last week on Monday, and the
Arinda, wait just
students.
a second. Arinda, wait just a second, because I want to go to those pictures, but I want to just give everybody the baseline here of what we're talking about with South Africa, just because let's orient. She's right now, what time is it where you are right now?
It's round about it's round about 1 o'clock in the morning. Yes.
She comes to every one of our webinars, and it's 1 in the morning where she is, and she gets up every time and watches the entire webinar. So
Yes,
she's
I
in
love
South Africa. What of
it.
the areas here are you in? East?
Okay, we
Whoops, I'm
are
sorry.
in
Wait, we'll go back.
Victoria. Oopsie.
Where is
We
it?
are, if you look at the picture on the right, at the top where you see Africa, I'm almost at the bottom, at the southern tip, almost at the bottom. And then I can't really see, binne nie sit 'n bietjie harder, die
Look
ding.
on the right hand side over here. I tried to get a close up. Is it of
Yes, it's, I'm trying to just put it a little bit sharper. You know that, can you see that little yellow spot on the right bottom map? That yellow spot.
not
It says Gauteng.
yes, right here.
Yes.
Kind of on the east coast, close to the east coast. That's Lesotho, Dubin.
Not
I guess that's
so.
Lesotho. Lesotho?
Limpopo,
Limpopo, just under Limpopo, you'll see like a mustard color spot there,
Okay.
right there. Can you see
Okay.
that yellow spot?
I think she's
Yeah.
right here.
On the left side, it says northwest, and on the right side of it, it says Mpumalanga. It's green, between the green and the pink. Just up, up,
Interesting.
up, 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 up a little bit more.
Not up here. Whoops. Going back. That's okay. I'm sorry. I should have gotten more clear. No.
Okay. Can you see Free State? It's the pinkish, almost in the middle. It says Free State.
No, let me get rid of this.
Can't you
Hold
see
on.
it? No. On the right hand, on the map on your right hand side.
Oh,
at
over
the
here?
bottom. Yes. Yes. Just go up a little bit more.
Oh, Free State.
Up,
Yeah.
up,
Okay.
almost. You see Free State, and then you see there, right there. That's.
Oh,
where
you're
we
in
start.
Johannesburg. I should know that.
It's just the town next to Johannesburg,
Okay.
Pretoria.
Okay, there it is.
Yes.
Okay.
Yes.
Sure.
Can you see that? Exactly
Yes.
there.
Fantastic. Okay, so on this map it would be, oh, there's Pretoria right there.
Yes.
Okay.
Yes.
I just wanted to,
Yes.
and that's your flag. I just wanted to give them
Yes.
what's going on for you there. Okay, now I'm sorry. Go ahead back here. I have a bunch of the pictures you sent me. So here's the first one. This is for your first official big class, as opposed to the ones you've been teaching more informally.
This was the interviews, because we had 29 people applying for the bursaries. So I just narrowed it down by picking 10 of the people, and we had interviews that day. And sorry, I don't have a proper facility. So this wonderful man that just opened this business, it's like a shared office. And we didn't know it, but we were his first customers. And then when I heard the price, we just couldn't afford it. So he offered it at about 30% of what he usually would charge. And so we were the first customers there, and he's been so good to us, this man. So we had a very professional look and a lovely conference room and everything. So it was wonderful for the students. It was really wonderful.
Look
Yeah.
at your banner there. That's so professional. You're making me look bad, Arinda. I've not done anything like that. That's beautiful.
Never.
Oh my gosh.
Thank you.
Oh,
Thank you. And
let's
this
see.
is my on the right hand side. It's my daughter.
Oh,
yes.
let's see. This is your daughter.
Yes, on the right, that's my daughter.
And
She
this is you.
is currently. That's me. Yes, that's my daughter, and that's me. And that is on the left side is Jacqueline. It's a girl that started with me in January, but yeah, she was so desperate to do this. She's actually also she used to work as a wound care specialist, but she wants to do the foot care. That's the passion of her life as well. You know, she saw with her wound care training, how much, you know, problems there are with feet. So
Yes.
she also did the course.
Oh,
Yeah.
that is so fantastic.
And then I actually, the bursaries I had, I actually wanted to choose 3, but then I ended up, you know, loving everybody. So I decided to train all of them. Yeah. Yeah, I decided to take all of
I have more pictures
yes.
in a minute. I guess I put this out of date. So this is on her website. Look at, she's so organized. And so these are her dates coming up. And she's doing it in different sections for
Yes.
different groups and different times. And that's all on her website. And we don't have to read this, but you guys will recognize, just reading it yourself quickly, you can recognize this. This is what, it's international, what we need to do. Basics in basic and advanced safety and treatment in foot and hand care. The module link. I mean, she's doing the same things: effective and safe filing and clipping, doing an evaluation of the foot, knowing when to refer your client to a surgeon, podiatrist, etc. She is, and that's what she's done all along, but it's just, she's organized it like that. Oh my goodness, I'm so proud of her. So tell us about these.
Yeah, this was really wonderful. The picture on the left-hand side, I had to, because I was supposed to take 3 students, and then I decided to take, you know, all of them that were so passionate.
Oh my gosh.
So I had to budget very carefully, but I got these beautiful cases for the equipment, and I had a friend of mine embroidered their names and the logo on it, and they were so proud when I handed the cases over. You know, it was just like the best day of their lives. It was just wonderful. And the picture on the right was their first clinical day. Can you see the gate there? We were actually on our way into the Alzheimer's ward. The people are very poor there, and there's some of the people that's been lying there for 20 odd years in the same corner. So where I started out with foot care, and I just love those people. And yeah, so this was, you know, sort of we practiced for a whole week. We did theory and practical on false nails, and I used press stick and
That's
you
these
know, all
supplies
kinds
down
of.
here.
Yes, I used that to let them just practice for that whole week. We just did the practicals on the false nails, and it was the first time that I've done that, and it just worked so great because we did not have any injuries whatsoever. It was amazing for me to see. So that was so we went through that gate, and then it actually started. You know, the next picture that you just showed. So yeah, if you look at the picture on the left side, that's my daughter. She also did the course. And she's actually been doing feet since she was about 2 years old. She sat on my lap and
Oh my
rubbed the
gosh.
cream on for the ladies. But yeah, we decided that she officially needs to do the course, you know, to work with me. And yeah, so she loved it, and she did a lot of the managing. She helped me with that. She was just a star in because I would never have been able to do it alone. It was just too much. And then
Yes.
that picture in the middle is the lady that's sitting in the wheelchair there. Her name is Sarah. Lovely, wonderful. I've got permission to put the photos on and to say her name. She's a lovely lady, and she was so thrilled. You know, they're not used to touch anymore because nobody touches them, and they don't get any visitors. So when the lady that's bending down on the floor there, when she started working on her, Sarah cried because, you know, just because somebody is touching her.
Oh my God.
That was quite marvelous. And the lady that's standing at the back, that's Jacqueline, and she attended to a paralyzed lady that's, I think she's been there for about 20 years with no visitors. She's
Oh,
so for her to see us is just the greatest thing. Yeah, they're very happy. And of course the type of nails, that the conditions that we see there is just magnificent, you know, something of everything. So it was very, very good experience for them. It was hard on them, I think, because we worked very hard for 3 weeks, non-stop. We worked, but yes, when the course ended last week, or this week, they said they really feel confident. I can go ahead. And this lady sitting here on the right-hand side is Candy. And she is pregnant, and she went now to go and have a baby, and then after she's had a baby she'll be back to carry on with her practical hours.
oh my goodness. Here's some more. How
Yes,
about
this
that?
is on the left hand side is Andronika, and she's actually a care worker that I got to know at one of the old age homes where I work. And she's such a lovely, passionate young lady, very hardworking. She's one of the stars, really, in the group. Excellent, excellent worker, and so positive. And the lady sitting there at the back, just underneath the TV, is a lady that is 64 years old already, and she lives in Mpumalanga. That's one of our other provinces. So she came all the way to attend the course. And yeah, she really added so much wisdom, you know, to the course. As you can see, we're not working with linen savers. We're just using the people's towels that they've got to try and save a bit of money. Yeah.
Isn't that great?
And
Oh,
then the girl in the middle is Renee, also a lovely girl. She actually, I've got two different courses that they came in for, and the one is called the assistant food therapist course, and she was interested just in doing that. But after the first practical, I saw, you know, how good she is, and we persuaded her to do the full course. Now she's very happy now. She didn't believe that she would be able to do it. Yeah, so she went with me today to the first old age home, and she did so well. Yeah, I'm very proud of her. And
oh,
then on the right hand side is Karen, and again Benelli, my daughter. And yeah, they all turned out to be really excellent with the practicals. There's two students that are really, or four of the students are really good with the theory as well. But I think what I aim for is an 80%, what do you call it? Yes, what is last cycle? They have to, the standard is 80% to the average that they must have, because I just feel, you know, that they have to know the theory very well in order to work safely.
isn't that
Okay.
something? Oh my goodness. That is, and you were there. I mean, holy cow. First of all,
Yes.
you not only got them those beautiful carts, but you got them these uniforms.
Yes. Yes. You
Okay,
know, Dr.
you-
Julia.
we're not doing that in Issaquah, people. We got you new chairs. You don't get bags and you don't get uniforms.
Oh,
Big campers
shame.
for
Yeah,
people.
but your chairs are just beautiful. Yo, that's really special.
I mean, look at
Yeah,
you. That
you
is
deserve
so
that.
amazing. Oh my
Thank
God.
you.
Oh, here we
Oh,
go. How about this? So this was your entire class.
yes, yes.
Isn't that stunning?
Yeah, sure.
Beautiful. And look, they're printed. Okay, and we have a video that she sent us. Okay, everybody ready?
Wait. Oh, shame.
Isn't that fantastic? Oh my gosh. Yeah.
So,
And she has a lot of things on her website, but I know that all of you would so understand what one of her former students said. My training with Foot Care Family Academy was amazing and understandable. I enjoyed every practical class, and I had our models for very friendly. The most enjoyable part is the theory. It is very insightful. I didn't only learn anatomy and physiology, but also hygiene and communication skills. It changed my life in so many different ways. I now own a successful business and I'm doing very well. I'm happy with the career path I chose. I recommend this course to everybody who wants to make a difference in the lives of others, reducing their suffering and increasing their mobility. There is a huge need for foot care therapy. And this is a former student of yours. And I think that says it all, and we can all relate to that. And just what you're doing, Arinda, is amazing. Oh.
thank you.
And she did give our association some credit. We made a contribution, and a couple of you have made some contributions to them to help get their this training off the ground. So we appreciate that recognition. But I think, you know, seeing this, wrong way. Seeing that is something we all understand, and that in your work, I can't believe what it took to put that. I mean, I do know what that took to put together. And I just can't believe what you've done there under the odds that you've done it. Oh my gosh. Brenda.
Thank you.
Oh my
It's
goodness.
amazing to see now, you know, that that we've created jobs, and to see the people's faces, because I'm actually 3 weeks behind schedule now with my old age homes. So this week I took the students with me, 2 at a time, and the relief on the people to see that there's more, you know, there's more therapists that's helping. Because I'm getting home at night, almost every night, around about 7, 7:30, sometimes 8:30 at night. And Sham, I think the clients feel sorry for me, you know. But now they see there's more in pink uniforms, and yeah, it's a relief for everybody, Sham. Yeah.
Oh my goodness. Brenda, this is, I know that part too. It's exhausting. Because
Yes.
you have to monitor all of them, and like me, you're lucky to have wonderful teams to work with who
Yes.
come to you with a sense of their dedication and with skills. And oh my gosh, I couldn't be happier for you at this first official class. You've been doing it for 30 years and teaching, but now you can't quit. You know that now. Trust me. Once it starts, they don't let you go.
Yes.
I'm glad your
but
daughter
you
is
know,
very
I
happy.
think.
What?
Oh, sorry. No, I just wanted to say that, you know, in the beginning, it was the people didn't believe me when I said, well, I'm connected with America and with Dr. Julia. They didn't want to believe me. Some people even sent me letters that I'm lying. I'm not connected to, you know, I don't really have a sponsor. That was so strange to me. But then when I showed them your video, you know, of you wishing them, you know, to have a good course and everything, it sort of just brought a relief amongst everybody that I'm not just this fly-by-night person, you know. Yeah, so you really helped me so much. If you didn't reach out to me to help me, I wouldn't have had anything. I wouldn't have had anything. And it's really, I'm living my dream. You know, for 3 weeks, I had to get up very early in the morning, you know, and prepare, and then come back home very tired and everything. But I read a book. I can't remember the book's name, but this woman said that she smiled right into her liver, and it was exactly how I felt. My smile went all the way through my liver. It is just the most amazing 3 weeks, and to see the students and their confidence, and you know, to see them uh, have hope for a future. That is just amazing to me, because by all the old age homes where I work, I've got so much work for at least 2 more, you know, therapists to work with me. And I can just see in the near future we'll have to bring in another one, you know. Yes, and hopefully all the old age homes in Pretoria will start connecting, you know, and then my plan is to also go to the next town, to Johannesburg, because it's completely new in Johannesburg. In Pretoria, I've been doing it for a while, so you know, most of the old age homes know about me, but I've only got 2 hands, so I can't attend to everybody. So yeah, so I'm really happy, and I'm thrilled, you know, to just every morning when I arrive and I stand in the old age home, because the old age home then offered a room for us for free, and that I didn't expect, so I kept money aside for that, because I was so worried, you know, that I would have to pay, have to make a big expense for a training facility. And then they offered it to us, and they said, no, we can have it for 3 weeks. And we invited a couple of speakers, and then a doctor offered to do the anatomy and physiology class for me. So yes, they had excellent tutors as well. Yeah, so it's just so amazing for me how everything came together. Yeah.
Look what you've done, girl. Oh my God. But you know what? None of it happened with you've been, I know, because I talked to you, it's been almost 2 years now. Did you realize that, when I was going
Yes,
back through some old
can't
things?
believe it.
When you first talked to me and told me what you were fighting there as far as getting any recognition at all for what you're doing and to get the legitimacy, and then you wanted to expand, I couldn't believe what you were up against. And you kept fighting and fighting. I mean, you reached out to me. I know a minute ago you said I reached out to you. The truth is, you went on the internet, and I get this email one day from this woman in South Africa. And okay. So I obviously contact you back, but you've pushed this forward the whole way. So don't for a second not give yourself credit. You've pushed this boulder uphill for 30 years. And
Thank
there's
you,
further
Dr.
to
Jim.
go uphill. You can't get lazy yet, but look what you've created. Oh my gosh.
I'm very thankful, really, and
That,
humbled. I'm so humbled by all of this. It's really so marvelous. It's, if I think back, every second, you know, every trial I had and every uphill I had to, it was worth the push. Yeah. You know, if I see the faces of these students, and I see the thrill, you know, in the eyes of the elderly, it just makes me so happy.
that woman that cried because she was being touched. That broke my
Yes.
heart.
Yeah, most of them are like that. Yeah, most of them are like that. Yeah.
Oh my gosh.
So.
Does anybody have any questions for her? I know that Debbie's letting me know that Max, does Max want to speak about that or something else? Oh, Max is from Neighbor Care. So that's about the other thing, isn't it? Or Bonnie
Yep,
or Debbie?
that's something else.
Okay, so we'll wait on Max. Does anybody have any questions or comments or anything for Arinda? Debbie, I can't see him, so I'll have to rely on you.
Oh, there's lots of thank yous, and you know, very wonderful work that you're doing. Thank you very much.
Thank you.
She's just beginning. Oh my gosh. But don't any of you think I'm getting you carts and uniforms. Not happening. But I'm sure you can go to South Africa. She's invited me. After
Yes,
COVID, I'm going to be going.
Definitely, we're waiting for you. We're dusting off the chairs for you.
Well, we want to really congratulate you for what you've done and how hard you've worked to do it. I just sort of fell into it. You have pushed it the whole way. So
Thank you, Dr. Julia.
that's amazing.
Can I post your email?
Can
I
Debbie put your email address on there if they have any comments they want to send you?
Yes, the email is food family training. Shall I put it on?
if you know how.
That would be
Shall I
great.
just type it in?
Yes.
Yes.
I will type it in. Okay.
All right.
.com. Nee.
And go to her website and look at it. She and her son put that together, and the whole thing is so professional.
.com. Thank you, Dr. Julia.
Well, thank you, Arinda, for spending time with us and
Yes.
showing how she just finished her first class, and that's why I couldn't wait to show you the pictures that she was sending to Debbie and Bonnie and I as she went along, and Kim West is involved with this too. Kim, thank you. So I hope you were here today so you could see all this, but I know you saw the pictures already.
No.
All right.
I
Arinda,
appreciate
any
it,
final?
and I appreciate it so much to be a part of this, and to be invited to the webinars is just it's amazing for me. And what I'm doing now is as soon as the students all pass their final exam, then for their prize they'll be able to join. So
Yay!
next
That's
time or
very
in 2 months'
nice.
time,
Oh my
you'll
gosh,
see
that's
all of their
fantastic.
faces. Yes, that would be great.
Oh my gosh, that is
Oh,
great. Oh,
Thank you
yeah.
so much.
thank you,
Okay, so
Arinda.
hopefully you'll be able to talk to them a bit. Yeah.
Yes, I'd like to do that. We'll set up a Zoom meeting with them, okay?
Yes, that
See
would
if
be
they-
great.
Yeah, I'd love to do that. Okay, my dear, thank you for
Thank you so
letting
much.
us know what's going on. And then you and I will
Okay.
talk again soon, okay?
Yes. Good.
Okay, we'll
Thank
talk to you
you.
later.
Congratulations on your beautiful clinic.
Thank you.
Yeah.
See, we all
And
have
if
new
I could,
things.
if I may just say, I'm really so touched by Lisa's presentation that she did. It's heartwarming for me to see how hard people work to get the word out and to get people help. Yeah, it's wonderful.
It's the nurses and it's people who are in the front lines like you, and they're the ones pushing it, and we're having to fight an uphill battle every day. But that's why the AFCNA is here, because this is our place to build that force so that we can get the care that we want to be able to give. So thank you. Okay.
Okay, Dr. Julia. Thanks.
Okay.
Bye.
So bye. So
Bye.
Debbie, talk to me. Tell me what you.
I'd like to invite Max to speak with us. Where'd she go?
Sure. Hi, this is Max. Can you hear me?
Yeah,
Yeah.
Max. Hi.
Can you tell us where you're at and what you're up to?
Oh, yes. Generally speaking, I'm in Seattle, Washington. I'm a community health nurse. I am currently working with Neighbor Care, which is a great organization that does integrated medical, mental health, and dental at some places care for people regardless of insurance status, any insurance, they take any insurance or no insurance. And
Max, I just turn your camera on if you have one. I just made you part of the program.
okay, I will confess I am working from home today, so you're gonna see
okay.
me in my basically close to pajamas kitchen, but I think it's okay. Let's go ahead and do that.
It's nurses. We're good. And by the way,
All
were
right.
you at my wound care program there for Neighbor Care last week?
I sure was, yeah, a couple weeks ago. Yeah.
Yeah.
Oh, there we go. So I got purple hair today.
Oh, I
There's my
recognize
cereal
you.
boxes over there. Hi. Yeah.
Don't worry.
And there's only 10% left on my tablet battery juice, but my phone is good, so we'll still have audio even if the video drops out. Yeah,
Okay.
it's great to see you all. And Dr. Julia, it was so great to be able to participate in your wound care training over there at the Pacific Tower. Like, it's just always great to get your expertise and input
That was
And I
the
think
first one
just,
since COVID. That was my first live talk since COVID.
yeah, it was great. I
Thank you
I
for
got a
your-
lot out of it, and I feel
Thank
like
you.
having the dialogue that you really create in that environment has been really helpful, just in terms of us all knowing what additional types of resources are out there related to wound care for the lower extremities. And yeah, I just really enjoy your presence in the room as well.
Thanks,
Yeah, I
man.
mean, you come with so much humility, and at the same time, you have so much expertise and like such a, and you're such a leader in the community. So
Well, like I
thanks for what
said
you
that day,
do.
I learned so much from you guys. You guys are the most amazing nurses. A lot of what I teach, I've learned working with you guys. And I've worked with wound care clinics all over the world. Well, that's not true, all over the country. So anyway,
I really feel that like I'm gonna turn that off. Any good teaching is bi-directional. I feel like, before I became a nurse, I was a dance instructor, and I learned so much from my students. As so, yeah, I think that's true for all of us as nurse educators. It's so important that we learn from the individuals in the community that we're working with, whether it's related to what their needs are, what their preferences are related to their care,
yes.
what the care gaps are that we need to address as a community, as a health community. Yeah, but I'm not sure, what was it you wanted me to chime in or ask? I
What
was
I
just curious about your chair. Can we get one of those
Oh,
for our clinic? I
yeah.
don't think so, but maybe.
But you
Hey,
were
Rosh,
talking about making space in your community health space for foot care nurses to use.
Oh yeah, the setting that I work in, I'm in a particular group within neighbor care, and we don't have like a
are you the
regular
hot team?
medical.
Are you
Yeah,
in the
yeah,
hot team?
yeah. That's right. Yes. Yeah, so we don't have like a normal medical office, with like all the accoutrement.
They're in a
um,
basement. This poor girl.
it's almost like a converted custodial closet, but it's
Yeah, it
okay.
is.
We're very adaptable, and we do a lot of our own cleaning and tidying, and so that's. But yeah, so in terms of like the exam table, we in the particular building where I work, that the exam table is up on, like, there's a couple steps often to get up to the exam table, and you can put the
Yeah,
back up, but
yeah.
I worry about people with their balance, like climbing onto that, and it's just me. I weigh like 108 pounds, so like helping somebody, up onto that exam table,
Yeah.
so that I can have good ergonomics when I'm working with their feet. It feels a little, perilous. And so when I saw your chairs, I was like, oh, we never use the exam table anyway as an exam table. It's just not what we do as nurses, in that setting. But we do a lot of foot care, a lot of lower leg extremity wound care. So I was like,
Yes.
oh, maybe we could get like I used one of those chair things that you showed, like, or something. I don't know. I don't know
they're
what our
like
budget is, but
they were right under $3,000, which I know is a lot, but it's not 15,000.
right. Yeah. Okay. Cool. Yeah. Thanks. Thanks
So
for
I
the
can
info.
hook you up with that. We can talk about that because
Okay.
we haven't used them yet, but they're amazing. They're not as amazing as the 15,000, but I am so excited, and it would be perfect for you. And they take up
Well,
to
I think I
400
have.
pounds.
Oh, perfect. Yeah. Yeah. Great. That's great to know. Yeah. I'll just reach out to you via email. I think I have your email, and I'll just ask you, and maybe I'll do a ask like once you've tried them out for a little while, and
Yeah,
get the
next
real
week.
deal.
We're going to have clinic 3 days next week. So
Could you
Amazing.
drop by?
Amazing.
yeah,
Could
drop
that
by. Yeah, you
Maybe,
should come by.
yeah, maybe I could. I'd be happy to if I can swing it. I'm also in a DNP program, so it's a little,
Oh, it's just
but
a little busy.
but yeah, I could probably
We do
arrange
it
it.
every month. We do it, I think it's usually the third week of every month on a Wednesday, Thursday, and Friday. So you and I can talk. My email
Yeah,
address, it's on your nurse's board, but it's juliaoverstreet@yahoo.com.
perfect. I'll reach out to you via email. Thank you, Dr. Overstreet.
Yeah,
Thank you,
but
Julia.
Lisa, so is Lisa still on? Because you two, you can help her a little bit, maybe. I don't know, because you're doing the community work that she wants to do, and they do foot
Yeah.
care.
Oh, I took down Lisa's email address for that reason.
Okay.
Actually, I thought I'd maybe just reach out to her directly. Yeah.
Yeah.
Yeah. Thank you. Yeah.
Thank you.
Yeah. I'd be
Great.
very happy to help and interested in talking with her and more and collaborating with her. That's such a great project. I was very impressed with her background research on that and the way she did some CBPR, as community-based participatory research, to kind of assess the needs. Yeah. Yeah. I thought that was really well done. Yeah.
I've gone out with some of you, your hot nurse team years before COVID, and boy, you make it work.
We have a really amazing group of nurses. I have
You
to say, I'm
do.
very proud to work with my peers on the team who just they're so like warm and they're so caring and they have so much knowledge and expertise and
In everything. I
they're
mean, you can come to them with a
unafraid,
splinter
right?
to a hemorrhage and you're there.
Yeah,
And you're
yeah, I
calm
feel,
and you educate them and on their level. I mean, and so I couldn't do
I
your
mean,
work. I mean, it takes so much
yeah, I mean, again,
energy
I
and
think it's bi-directional. You know, we learn from the population that we work with, as well as hopefully being able to offer some education related to health stuff. So I really feel strongly that it's gonna go both ways in order for us to be effective. Yeah. Anyway, thanks for letting me be an unofficial panelist. Wasn't
oh,
expecting
of
that
course.
today.
Well, also, Max, remember or keep in mind, because I've always done that with you guys, any foot care and wound care, but we try to fit in your nurses at no charge in our foot care class when we can, because that's our duty is to help, that your group to serve so many. So remember that I do that,
Thank
and
you.
I'm still on staff there, so I can come there and do trainings, and we can work on it. Because I
I
think most
really
of the nurses
appreciate
I
that. Thank
trained
you.
are gone or up like Rachel left you for management.
Right. Yeah. Yeah. Thank you. I really appreciate that. Yeah.
Yeah,
I think you would work with nurse Corey Sutton, who's a nurse practitioner
sure.
now. And that was
Yeah.
how I first came across your work. And that was at a different organization. And, and then Corey trained me in my very initial foot care stuff. And I was like, what? This is
What?
so cool and weird. And I never expected to be doing this. And yeah, and Corey also just spoke very highly of your work. So
It's a natural
thanks for
fit
all
for
that.
wound care people to do foot care. It's just a natural fit, and we
Right.
appreciate for skin people, so we get it. What's
Right.
going on with that? Okay.
Right, we
Well,
already
stay
have
in
the
touch,
socks off,
Max.
so why not just make the mobility easier too while we're at it, right?
Exactly.
Because that's going
Yeah.
to help with, blood flow and everything. Yeah.
Yeah.
Well, I'm going to go off
Quality of
camera because I
life.
feel a little sheepish about this
Oh,
presentation
okay.
here.
You were great. Thanks, Max. I appreciate
Thank
your
you.
letting us drag you into this, but it fits
Thank
with the
you.
program today.
Yeah, you're a real
Thanks.
So,
gem, and thanks for the impromptu.
so reach out to me and we'll work on something.
I sure will.
All right. And be sure to turn off your mic too, or we'll hear you doing something you don't want to hear. Hot mic.
Oh, we've got a lot of great members.
Don't
Great
we?
course. Yeah.
That's why I wanted to do a thing like today where we could feature some of them, because we have such talent in our group and worldwide, not even just nationwide.
So when's the open house?
When's the open house? Yeah, that's going to happen. Not this month. We're still figuring out where to put things in drawers because we've reorganized to make it more accessible and less hectic. And so,
Okay, well, beautiful job, and I thank you for all that generosity. Holy crow. It just makes a dream for any student walking in.
oh, I'm just so excited. I can't tell you. I haven't been this excited in a long time to get these chairs. It's been just, it's so
Well, I just
exciting.
remember the folding chairs I think we had way back
Yeah, you
when.
were way back. You took the class at the senior center. I think Bonnie
Yeah.
did too.
Yeah.
Yeah.
Anyway,
Debbie came down from Canada to go to a senior center and sit in folding chairs and do foot care. And she already knew how to do foot care. I have no idea why she came down, but I'm glad she did.
you see cases there that we'll probably never see in the rest of our career.
Oh, you should go to Neighbor Care, where Max is from. There you're going to see cases you'll never see again.
For sure, but it was awesome as a beginner to have you there, and it's like, okay, look at this. Oh, yes, and you've called emergency a few times when we've been there. So you recognize it, and you've got their hotline, and they take them right away, and it's just awesome.
Yeah, luckily we haven't had that in a while.
Well, I was there for a couple of them, thank you.
Were you? Yeah, we went through a bad time, but you know how that goes.
Well, that wasn't anything we caused. It was just they
Oh,
walked in.
no, make clear that. No, they would decompensate. sitting in a folding chair like that, kind of leaning oddly and putting your foot up. My theory was that they would decompensate because they couldn't really move too much. It was just a folding chair. And I think their inguinal blood flow was so pinched for so long that it affected their blood pressure, because we would have people go have cardiac issues and pass out. And I think it had to do with that whole setting, which is why I worked to get those recliners at first. So yeah, we've had people decompensate, and that's why EMS would come, because they knew I wasn't messing around. This isn't
Well,
hanging someone.
you've
Hmm?
also recognized situations where they probably should have gone to merge a week ago.
Well,
Yeah.
that we all do that. That happens still. We had,
Those are the ones I'm talking about. Yeah.
yeah, we've had 3 of those this year. So, because we, like you guys, we're looking at the feet. Nobody else is, and we're seeing things that,
Yeah.
or
And
talking to them, or watching them kind of get pale and sweaty in front of us. And we have the time and the ability. And luckily, because I'm a podiatrist and a wound care, I'm with 6 nurses who are really good. Every month, our team of new student nurses, or not students, come in, and I can just point, and several of them will know exactly what to do. I mean, it's a team effort. I can recognize it, but I'm not trained to know what to do. I'm like EMS or nurse. Like that's what they train us in doctor school. Nurse, you take care of this.
well, a lot of it is front line where these people have been isolated for so long and they show up here and it's like, oh my gosh. Yeah.
Yeah. How quickly can we cut your nails? But that's not the point. Okay. Well, I didn't know if we'd have enough to go through to 5 o'clock, but we did, didn't we? Wow.
And where did you order your chairs from, they say?
Oh, it's called Spa Source, SPASOURCE, Spa Source. They actually sell, it's actually not a podiatry chair, it's a physical therapy and massage chair. But it's designed with the 3-way motion, just like that. I don't know if I would have bought them if I would use them 8 hours a day, 5 or 6 days a week in my practice. But we use them, a few times a month for all day. And the motor seemed good. 400 pounds. There's 3 separate motors. But anyway, Spa Source Limited, they're in Southern California. I think it's a small company. You get Mary, who is the woman at the desk, but they did what they said. It arrived when it was supposed to. It was a good price, and I'm real happy so far. Really quality material. They have them made themselves. They named it something, and they have different options. I definitely wanted the one where it would tilt, but they have some that will like throw you out of the chair. They have different options, but you'll see what they have. It's meant for massage or PT, but hey, you can see on their chat line and everything that podiatrists are getting them because they're like $3,000 instead of $15,000. So
Last question, is there any update on when the next conference will be?
no, we've canceled it for this year. Things are just too fluid still, and then for a number of reasons, it just wasn't going to work. So we're shooting for March or early April, March or April of next year, but we haven't settled on a city. We think we're going back to Minnesota, but we're also considering the Denver area. I don't know. We're still, now that we have the time to plan it, I sure liked going to Minnesota. We have a big cohort of members up there. So nothing's for sure, but it won't be this year. We're making new videos all the time. I'm making one for you guys now on questions you've been asking me. What's a good, don't think of it. Some vascular and neuro questions that I get quite a bit. So we're trying to make new videos, but that's not the same. And I know. So hopefully in the spring of next year. Yeah.
Okay. Well, thank you.
Anything else on there
I
for
think
us?
that
Any other questions? You guys, I really appreciate your coming to these. It's fantastic, and it makes it feel like such a community. And I hope you all are reaching out to each other too, and that you have all joined. I know I sound like a broken record, but all the time I go to look somebody up and you're not members. How can I reach out to you? You've left me a call or done something and I'm trying to reach you and you're not members, so I don't have your contact information. It's free, people.
well,
Join.
it's also allowing us all to network with each other too.
Yeah. All the time, every single day, I get calls from nurses around the country who want to start this and want to communicate with people, with nurses, foot care nurses in their area to see if they like what they're doing, how do they get trained, what do they, what they want to ask people that they are in their area. And a lot of you aren't on there. And, you know, it's just, that's how we build a community. So please join. Okay, a lot of you, by the way, who are certified are not members.
What?
We made that necessary now, but I didn't have that as necessary before because I thought, well, surely everyone will join who wants to go so far as to get certified. And an amazing number of you who has certification are not members, because when I go to update your certification information or whatever, I have to put you in myself. You're not members. So please, for me, because I'm a party of one and I'm trying to add all this stuff, please join. I promise I'm not organized enough to send you spam mail or anything. Just join. All right. Thank you so much. Thank you, Lisa. Thank you, Arinda. Thank you, Max. Debbie, of course, our best wishes to Bonnie. And our next program is May the 12th. And the speaker that day is going to be the grant writer specialist that Bonnie's been working with
Oh,
her
right.
seniors. I think is that June or May?
I think that's May, but it took Bonnie a lot of emails, find out who's who
Yeah.
and everything to get this. But yeah,
So she's
Bonnie's,
going to give us some input on how, if you're trying to get funding for a project, you know, like Lisa's, for instance, she's going to go over the grant process and from your point of view, who do you reach out to who knows how to do that? Or if you have to do it yourself, how do you do it? I mean, she's hopefully, or not hopefully, I'm going to meet with her on a Zoom next week. And, you know, I'm going to let her know that what we need is some grassroots information for the kind of projects that you guys might want to put together to get funding. So that's next month in May, and May 12th. So thank you so much. Debbie, any final thoughts, words?
nope, thank you. This is awesome. And thank you
Okay.
everybody for coming.
Thank you. Take care of yourselves, and we hope to see you again in May. Take care, everybody. Bye-bye. Except now, I don't know how to get out. There we go.